And welcome to Grantmakers in Health Thought Leader Conversation on Mental Health. I am Allison Perencevich, Program Director at Grantmakers in Health, leading our work on behavioral health. Mental health is fundamental to our overall health and well-being, yet individuals, children, family, and communities are experiencing immense amounts of stress, anxiety, loneliness, and grief right now. Philanthropy can help meet this critical mental health moment, both with immediate supports and long-term system change efforts, and by addressing the disparities and inequities experienced most significantly by communities of color. This timely conversation will dive into the current mental health landscape, highlight learnings in cost-effective prevention-oriented approaches, as well as share insights on the future of mental health and the role for health funders. We are grateful to be joined by two phenomenal leaders in mental health, Henry Emmons and Andrea Cole. Henry Emmons is a psychiatrist who integrates mind-body therapies, mindfulness, and neuroscience into his clinical work. He practices with Partners in Resilience in Minneapolis and is co-founder of Natural Mental Health. Andrea Cole is Executive Director and CEO of the Ethel and James Flinn Foundation, which is committed to improving the quality, scope, and delivery of mental health services in Michigan. Andrea is a board member of Grantmakers in Health and will be helping facilitate this conversation. So without any further ado, I will turn things over to Andrea and Henry. Andrea?
Thank you, Allison. Dr. Emmons, thank you for having this conversation on mental health today. You know, when COVID-19 hit last March, we had no idea that we would still be mired down in a pandemic 1 year later. The health and economic and emotional toll has been tremendous, especially for communities of color. So, as an integrative psychiatrist who's actually seeing patients now, how would you describe our country's mental health status right now?
Yeah, thank you, Andrea. I'm really happy to be here. Yeah, so just as you said, when this first started, I fully expected to be back in my office after about 2 or 3 weeks, and
Mhm.
here we are, almost a year later, and still not seeing people in person. And so, without question, this has been just a really challenging years. It's added so much stress in so many different ways than anticipated. So a couple of things of just observations I wanted to make about that. One is that the challenges we're seeing in mental health, particularly for young people, people of color, people who are in more economic distress, those things are very real and very strong. But I think it's worth pointing out that they didn't start with COVID.
Right.
The trends that we're seeing have been happening for a while. COVID, I think, accelerated them,
Mhm.
and also in a positive way, it has really raised the conversation about it. So the awareness is there. People are talking about these things more. But I was just participated in a summit on kids and teens mental health, and in the time of COVID. But the statistics we've been sharing are really clear that these challenges for kids and teens, as with the other groups, they've been going on for a few years, and
Mhm.
it's only added to the level of depression, hopelessness, despair, the suicidal feelings that a lot of people are overcome with these days. And none of this is new. It's just really heightened and accelerated.
Yeah. Actually, speaking of young people and actually children in schools, one of the things that our foundation did a few years ago is that we partnered with a few collaborative funders in the city of Detroit, and we supported a program in the Detroit public school system. And the program is called Trails, and it brings CBT, it brings mindfulness and resiliency skills, skills to all of the students, K through 12. And quite frankly, that work couldn't have not come at a more critical time with the pandemic. And we've also been able to expand some of the self-care tips to the teachers who are also stressed out. You've worked to develop programs on mindfulness and self-care for the University of Minnesota Center for Spirituality and Health. You've also done some resiliency training. at Northwestern Hospital. So what have you seen are the biggest takeaways or learnings from this work that you can share with us?
Yes, thank you. So one thing I'd say at the outset is that these conditions that we're talking about, and really the focus here is primarily on anxiety and depression, because those are the really
Right.
common things. Those are things that are so much influenced by stress. And so, truly, I don't think it's an exaggeration to say that these are epidemic right now.
Right.
So that being said, these are complicated or complex conditions. They really don't lend themselves to a single simple solution. And in our larger healthcare system, the approach that we've taken by and large to these conditions has been medication prescribing. At least if they get to a certain point with certain kinds of symptoms. And so my work, one of the reasons I consider myself an integrative psychiatrist is that it simply does not make sense to be so wedded to a single kind of treatment approach. It just doesn't work effectively. So one thing is to recognize these are complex conditions. The human condition is complex just to begin with. And particularly in a time like this, we just have to acknowledge that. So I really prefer to offer things that bring in a lot of the elements you just talked about, such as, good self-care, really, really sound science-based lifestyle medicine interventions really can make a difference. But again, not that alone, bringing in cognitive behavioral approaches, which are so well studied and researched, and you're probably known to be the most effective approaches to these conditions. Mindfulness therapies, because it's so practical, it's so portable. People can learn these skills and take them with them and grow them on their own. So a lot of what I think is so helpful is to weave these things together, create a programmatic approach that is really coherent and makes sense to people, and then kind of honors this complexity of who we are as human beings and what our needs are right now.
Just for the Dr. Emmons, for the viewers, if you could just expand what mindfulness and resiliency skills look like, what that really means, because for a lot of us, it's a term, but we don't know what that actually means. So what are the type of skill sets that we would be learning centered around mindfulness?
Yeah, great. So one thing I would say about resiliency is that I believe it is completely natural, inborn. It is our default state, if you will. And I think we've seen evidence of that during COVID. Yes, people are incredibly distressed, and our lives have been made very difficult, but if you look at it from a little different perspective, the way that we have responded has been remarkable, truly. We have adapted so quickly to this new world. And, just think about schools and teachers and students, how they've changed their lives and done it, not easily, but more or less successfully. So resilience is completely natural. However, there are a lot of things that get in its way. And I think that what we're seeing these days with this erosion of mental health that we talked about is really an erosion of resilience. It's those, that natural ability to be able to face whatever is in front of us and to do it with just enough skill and enough equanimity that we can deal successfully with these things. That skill has really been challenged and eroded. And it's things that take it away are the things like being distracted, not getting enough sleep and exercise, not having an adequate diet, being unable to shut your mind down, so that you're constantly, creating these negative thoughts that repeat themselves over and over again. So that's really where I think a mindfulness approach or practice comes in so usefully. And that is that, to me, it's very simple. It is simply the capacity to become more present or aware, to be able to direct your attention where you want it to be, not where it just goes automatically, but where you choose to place it. Because that one simple thing, and by simple, I do not mean this is easy, as you well know, but simply by learning to move your attention from all the things that are wrong in our world toward some of what's good, that one move, that one skill can completely shift your emotional life and the way that you feel and approach things in your life.
I would agree with that. I think for us supporting this work in the Detroit public school system, which the students are facing a lot of trauma, there are issues that their families are facing, but we've been very happy to see that providing students with some basic skills, coping skills, and just making them more aware of their emotions and really learning how to manage their emotions, how to see what their triggers are, how to say, I'm in a stressful situation. I recognize I'm in a stressful situation. What are some of the things that I can do to calm myself down? And just really getting students more comfortable talking about mental health has been really successful in the work that we're doing. And mindfulness and resiliency skills are very practical, but they're very impactful and effective. So that's, that's good to know that there are some things that we can do naturally to help manage our emotions as well. Just really building on that, I'd like for you, Dr. Emmons, to talk a little bit more about your book, which is The Chemistry of Joy and the Chemistry of Calm, and really talk to us about the book itself, but also what you see as some of the biggest barriers to translating this type of knowledge into everyday practice and systems change.
Sure. So the first book I wrote was The Chemistry of Joy, and it is my attempt to really embrace that complexity I talked about and try to put it into a coherence or a model that makes sense and that it's accessible to people. So it's looking at things in a very integrative way. And to me, integrative health does not mean necessarily alternative or new age or any, or just herbal. It's not one thing like that. Integrative means that we're just drawing upon anything that we believe or that has been proven to be of help to people. And so trying to blend those things into some sort of coherent whole. So the chemistry of joy was my way of trying to do that with depression, chemistry of calm, doing that with anxiety disorders or problems. And so we're incorporating the things we've talked about, the good lifestyle approaches, ways to restore balance, including brain chemical balance, and to tone down the stress system. And that can be done to a large degree through the lifestyle measures like diet and exercise and sleep and a few nutritional supplements. And then trying to help teach people how to build resilience, which is kind of that next step. Once you restore a little bit of health, get back to your baseline, how can you learn some of the skills that you were referring to that help prevent these problems from coming back in the future? And then there is a third aspect to this that I try to write about and speak about, but it's very seldom addressed in the mental health world. And that is, what can we do to really help people flourish, to thrive, to live with enough vitality and even joy that something like depression or anxiety just doesn't have as much of a chance to find its way back in. So really trying to think about those three different
Mhm.
aspects or levels of care and attention.
So really building on, you've mentioned integrated health, but just really building on the integrated care models that have been advancing over the years. And when I say integrated care, I'm really referring to integrating behavioral health services into primary care settings so that we're moving to a place that we are standardizing screening, assessment, and treatment in primary care settings when people are first having symptoms, and so that we're diagnosing that much earlier. If you can just speak to integrated care as well as what you see as preventative and early intervention strategies, especially for children and young people, and some of the best practices in that area that you think should be advanced or that philanthropy can support.
Sure. Yeah, so the integrative care that you're referring to
Mhm.
is, I think, is long overdue. You know, we have somehow created this separation between physical health and mental health, and it never made sense to me. I think it makes even less sense these days. You know, there simply is no separation. Mind and body are one, really. And so you know, bringing mental health services into a primary care setting and having people trained at higher levels to recognize and treat these things so that it doesn't become such a, you know, a divided world that way. That's I think, a really useful and important step. That's something we should have been doing all along, but I think we're beginning to make some strides, real strides toward undoing that. I think too that, you know, really important what you said about early detection and prevention, and there's research that goes back a long ways in being able to recognize in young children, even elementary, even pre-elementary, some signs that they may very well end up having a significant problem, particularly with anxiety. I think it's easier to tease that out with anxiety disorders, but you can tell at a very early age if one is prone to that. It's really a kind of an inborn temperamental thing that can be addressed. That's the point, is if it's recognized, it can be addressed. I think it's so important to be looking really robustly at intervening early and creating programs really very much like the program that you're doing in Detroit and that you described briefly, where you're giving young people the skills that help them deal with difficult emotions, that help to counter adverse childhood experiences with what I like to call resilient childhood experiences. And and sometimes I really believe that it does not take a very big change or a big intervention at that age. If you just help someone develop a very slight shift in their ability to withstand unpleasant or difficult emotions, that is an example of the kind of thing that could make a very big difference years down the road. You know, putting our money and effort into kids, teens, and I would say through college age, that the early 20s, would really go a long ways towards helping prevent this from being a long-term epidemic.
I would agree with that. I think the idea of integrated care and just standardizing uh, the approach of treating the whole person. I think if we can get to a place that we are diagnosing depression and anxiety much earlier and then giving people the coping skills that they need, it doesn't have to be, it's something that they can be able to manage. And I think we've had some success in this space. And I do think that foundations can be very impactful in looking at advancing these type of integrated care models as well as these mindfulness programs within school. So if we focus on primary care settings, and we're also giving children the supports that they need in school and or college, we can go a long way in just diagnosing early and giving ourselves the type of skill set that where we can manage our depression and anxiety much better. So I'm hopeful. And I would also like to say, Dr. Emmons, that during this pandemic, there have been some good innovations that have come along. And one of those is telemental health and virtual therapy platforms. In Detroit, we were able to support a virtual platform for all of Detroiters who were impacted by the pandemic, and it was specifically focused on African Americans who sometimes do not have the same level of access, or they're a little less or a little more reluctant to seek services. And so we funded that platform in Detroit, and it has been tremendously successful in really dealing with stigma and making people more comfortable on a virtual platform accessing services. So keeping that in mind, what do you think the future looks like in terms of mental health equity? How do we get there? What are some of the key action steps as well as barriers to getting us to a point that everyone has access to services and understanding that teletherapy might be a very effective way to get there?
Yes. Yeah, no, this pandemic has in some ways
Mhm.
really been a time of innovation and opportunity. It truly has. Things have shifted really quickly, really dramatically. And, the whole idea of doing things remotely over, doing telehealth for mental health was something that I admit I resisted
Mhm.
for a long time. And I think most people in my profession or therapists as well really resisted that, feeling it just wasn't the same and couldn't be as effective. And that still may be true, but what I think we've learned is it's not bad, and it actually offers a lot of access and simplicity and just the amount of time people have to take off of work, for example, to have an appointment. It's
Mhm.
just really changed the game. I think too that it's worth pointing out that while teletherapy or telehealth could really help with ease of access, it's still it still doesn't make sense to me for us to rely upon so much one-on-one healthcare. And that's where I think programs like yours, where it's not dependent upon one patient meeting with one doctor or therapist, but it's possible to really scale this and to do it in a way that really changes the game when it comes to access. So I've for a long time I have thought we really should be putting more of our money and energy into developing program approaches for these conditions, like years ago, I worked with the Penny George Institute for Health and Healing to develop a resilience training program. And, we could take up to 20 people in a group and take them through an 8-week class and do all of the things we're talking about doing. And it was wonderful. But this pandemic time has opened up my eyes that we could do this for a lot more people than 20 that we can do in person. We can scale these kind of things to really large numbers, and there are ways to create even that sense of community, doing things virtually that I used to think we could only do in person. And there's just a lot of innovation and creativity out there that we need to really embrace.
I agree. Just in the space of staying in the space of virtual therapy platforms, where do you see philanthropy being able to support larger scale implementation. So what are some of the things that we could fund to make some of the systemic changes that we face in having this available on a, to larger groups, as you stated? Why isn't telehealth available to everyone? Like, what are some of the barriers? Is it reimbursement? Is it funding? How can we be most helpful in moving that along, from your opinion?
Yeah, that's a great question. So I think we do need to try to free ourselves up from reimbursement. That has really been a challenge in the world of integrative medicine and mental health, because it's expensive to do these programs. And like our resilience training program, without it being supported in some ways with philanthropy, it just wouldn't have worked, because financially, so much of that is not covered by insurance. And I can tell you from at least my experience, it's very hard to get those kind of things covered by insurance. Very hard. And so I think that I think it's wise for us to try to rely less upon the insurance model, more upon either scaling things in a way that's inexpensive enough to deliver, or is supported by philanthropy dollars so that people can access it, much more easily. So I'm involved, for example, with creating such a platform called Joy Lab, and we are developing a program to really help people to get to that level of flourishing or thriving. So trying to uncover joy, and even if you've dealt with a mental health problem. And we're trying to use some of the things we've talked about already. We're trying to blend cognitive therapy, mindfulness, the science of mindfulness, positive psychology, which is really something worth knowing more about and kind of embracing. There's a lot of really, really good things that come from that lend themselves very well to these other things. And then just really trying to add some soulfulness to it. So trying to blend all these things into a format that uses technology, that does it pretty inexpensively. It still costs money to develop these things and to create the platform. And if you wanted to make it really accessible, you need to go through people's cell phones, so you might need to develop an app, and that's expensive. So, there are some ways in which I think philanthropy dollars wisely spent could go a long ways towards seeding some of these programs that, they're not so terribly expensive if you look at a per person, but still there's development costs, and, you still need people running these things and creating the online community and that kind of thing. So
I think your point is an excellent one around looking at programs that are, we do still very much need the clinical piece, and we do need access in primary care settings and other settings. But there are other programs that are not reliant on insurance that can be very impactful and effective. And the program that I mentioned before, Trails, is an example of that program. And I have to say that I'm very excited about the progress that we've had in Detroit Public Schools. And we're now in conversations with the state of Michigan to scale that program to all school districts in the state. And we've been able to bring philanthropy partners from both the health space and the education space, because there is an overlap, together to support this. And we're working with the state now. And so I'm very excited about these type of programs, because if we're able to successfully implement this throughout all school districts, then everyone has the same level of access to these type of effective mindfulness and resiliency skills. So, I can't really speak that much on it, because we're very much in the process of having those conversations. But I do think it's an excellent example of how philanthropy can provide some seed funding for these type of programs that can then be scaled at a larger level. So I feel like I might be jinxing myself if I talk about it too much. So because the ink hasn't dried, we haven't signed on the dotted line, but we're very much poised to bring this to our entire state of Michigan, and I'm hoping that we're successful. And maybe it could be, a national model as well.
Yes.
So stay tuned on that. But Dr. Emmons, are there other things that you think philanthropy can do right now to promote healing and resiliency just in general? What are some things that we can do?
Right. Well, I think that to me, I really do believe that the future of mental health lies in both integrated models, which we talked about, and that refers to bringing it more into embedding it in a very
Mhm.
organic way into primary care settings, and then integrative, which in my mind means blending these different traditions, health traditions, these different areas of information and practice that simply make sense, at least in my mind. Um, I think those two things, trying to focus on those, is a really, really good start. I do think that that putting some money now into developing some of these innovative, online, accessible, scalable formats just really makes sense. I remember during the Obama administration reading that they really wanted to support this kind of program model, for healthcare, and they were looking for, innovative proposals and that
Mhm.
sort of thing. And I actually don't think it was fully evolved yet at that time. But I think kind of going back to that, where, let's look not at these individual solutions so much, but let's look at scalable, community, broader, accessible solutions that are not dependent upon the more conservative, institutionalized model of medicine. You can't move very fast in a giant
Mhm.
institutional organization. You can't be as creative and innovative as for example your program is, and that from your experience, that you've got to be able to move quickly. You've got to be
Yes.
able to be flexible and creative about where you get how you fund these kind of things, because
Mhm.
if we wait for this to happen through the more traditional insurance based or healthcare system, I think we're just going to have more of the same.
Yeah, I agree. Where do you recommend that listeners and funders go for some trusted information, best practices, resources on some of the topics that we've talked about, or some of examples of programs that we can implement or scale? Is there one trusted place that we can go for this type of information?
Right. Well, I like to think that Natural Mental Health, my website, is one such place, and that really is our mission, is to try to pull together, those kinds of things
Mhm.
for both consumers and practitioners. And I think that the podcast and online program that we're developing called Joy Lab is I think could really, hopefully, really be an example of one of these things we've been talking about. In addition to that, I would say there's two or three places that I go to that I think are just really great resources, kind of broadly. One is the the mindfulness program at University of California, San Francisco. They just have done such a good job of making it broadly accessible, sharing really great information. So UCSF and Stanford also has a really good research and solid information about mindfulness. I also believe that the University of Minnesota Center for Spirituality and Healing is really a really good resource for these things, and they do health not just mental health, but integrative health real
Mhm.
broadly, and also, spirituality, the name implies. And I also think that Johns Hopkins it has a really great track record and program, um, as does the Cleveland Clinic now, has a really, really great innovative integrative health program.
I would also add to that 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 people might consider also going to the University of Michigan Depression Center. As a matter of fact, they are our partner on the Trails program. So they are implementing Trails and they have a wealth of resources as well. So the program is called Trails to Wellness. And the U of M Depression Center is a really good resource
Hmm.
to look at those type of programs as well.
Wonderful. Thank you.
Yeah, yep. So Dr. Emmons, what is one, well, you did mention your podcast, but any other blogs or a TV show or even just a publication or a book, well, besides your two books that that bring you joy that you would recommend that we read that just can lighten the mood or make us a little more joyful?
I really like the daily email. It comes from a place called Daily Good.
Mm.
And I believe it is out of the University of California, San Francisco, UCSF. And it's just such a nice counterpoint to all of the more difficult news
Mhm.
that we are immersed in. And it is kind of what it says. It's a way of redirecting your attention, every day to something that's positive, that's good in our world, or a new finding in the science and so forth. So it's usually a short read, really upbeat, kind of affirming, and yet science-based a lot of the time.
Well, on a personal note, what are three things that we can do daily? Three easy things that we can do that are positive and that just promote mental wellness for all of us who are going through very difficult and challenging times. We're moving forward, but we don't know, when we'll get to a point of normalcy.
Yeah.
So what are some simple things that all of us can do and add to our lives that just make us move in a more positive way and to think more positively?
Well, I will tell you the three things that I do every
Yes.
day that I think are really, really helpful. So the first is sleep, actually. And actually, I don't do that particularly well every day, but I work at it. And I think I've really come to see sleep as the absolute linchpin for mental health. So it's a big topic. I won't say much more about it, but anybody who's not sleeping well, that's a great place to start. Stick with it. Learn as much as you can until you are sleeping better. Um, Second thing that I've done since COVID started, and I know a lot of people who have done something similar, I go for a walk virtually
Yes.
every day, and a pretty good walk, maybe not always getting my 10,000 steps, but pretty close. And boy, that has made a difference. I'm not commuting, for one thing. And so I
Yes.
use that time to go for a walk, and I tell you, it's been a game changer for me. So that's just a really simple, and you can do something else besides walking, but walking is sufficient and it's pretty great.
Yeah, let me tell you, I that resonates with me. So one of the things my husband and I are doing because we're both working remotely is we go on a 1 hour bike ride every day. We ride just through our subdivision in our neighborhood. Unfortunately, the last 3 weeks, because of snow and cold, we haven't been able to do that. But I'm amazed at doing that one simple thing just is so helpful to both of us. And I can notice the difference since we haven't been able to go outside. And so now we're going to, since we can't ride our bike, we're just going to walk in the snow. Because I agree, just getting outside, getting some fresh air, seeing sunlight can just do wonders for your mental health.
Yeah.
So
So both of us are getting about an hour of exercise
yes,
a day and And I bet neither of us were doing that before.
We were not. We were not. So that's the one thing out of the pandemic that has been a good change for me, is that I'm getting regular exercise.
And then the third thing really quickly that I'm doing is
Mhm.
that each night as I'm falling asleep, I am thinking about things that brought me joy. And each morning, before I'm up and out of my bed, I'm thinking about the same thing, about something that is actually joyful or good in my life. And it's a simple thing, but it's a way of shifting my focus and not being immersed always in what's wrong.
I would say that's a wonderful note to end our conversation on. I want to thank you for joining me today. And this has been great advice. I will definitely be reading your books, and your tips have been wonderful. So just thank you for your time and have a wonderful day.
Thank you so much. It's been a pleasure.
Thank you so much, Andrea and Henry, for sharing your expertise and insights with the GIH community. We are truly grateful. For our listeners, thank you for taking the time to join this conversation. If you have questions for our speakers or would just like to get in touch, we are happy to connect you. Or if you have feedback or suggestions for GIH, please be in touch. We will post some of the resources mentioned today on our website for you to access. And we look forward to continuing this important conversation on mental health with all of you. Thank you again, and take care.